Hi guys, my name's Sanjay Gupta. I'm a cardiologist in York Hospital, and today I thought I'd do a quick video on the subject of what tests you need to get a comprehensive idea of what's going on with your heart palpitations and why they're occurring. Now, a lot of people write to me and they say, look, I've had this test. What next? What test should I have next? Some people say, oh, look, my doctor's saying have this and this and this. And the idea here is to try and discuss some of the important tests that you should have as a basic minimum, and also to discuss some of the best tests. Now, the problem is that sometimes when people go, and particularly if they're paying privately, okay, so if they're paying for the test, then there is sometimes a suspicion that maybe more tests than are necessary are being organized by their doctors because of the money. Sometimes there is a worry that, oh, well, maybe they're not doing all the important tests because I'm not paying. So I thought I'd run past some of the important tests, some of the very basic minimum tests you should have, and which tests offer you the most amount of reassurance if they're normal. So the first thing is, if you start getting heart palpitations, I think the first thing to say is it's always important to have an ECG. And now an ECG is a tracing of the heart, and it is only a tracing of the heart for a few seconds. Now, the ECG is very useful if you're having the palpitations when the ECG is done. Otherwise, it's not so useful. So a lot of people say, look, I had some palpitations 2 nights ago, and then I went to my doctor and he did the ECG and he said the ECG was fine. And my question is always, did you have the palpitations when he was doing the ECG? Because otherwise, the ECG does not exclude a problem or doesn't tell you what the cause of your palpitations were. The first thing to say is that the ECG can often be normal and a person can still have palpitations which could be coming from the heart, i.e. heart rhythm disturbance. The second thing to say is that sometimes the ECG can indicate a propensity towards a heart rhythm problem. So there's a particular condition called Wolff-Parkinson-White syndrome, and that is caused by an abnormal pathway between the top and the bottom chambers of the heart. And sometimes people can get very fast heart rhythms as a result of this abnormal pathway. And that you can pick up on the resting ECG sometimes. So in that setting, it's quite useful, because if you see that pattern and the person is complaining of palpitations, then you can, you know as a doctor that that patient has a propensity to this problem, and therefore it may be good to try and that the patient has a propensity to having palpitations because of this problem, and therefore you can get that problem sorted out, which is often to send the person to an electrical specialist and have the accessory pathway ablated. But otherwise, the ECG is not that useful. However, it's still always worth having an ECG to start off with, okay? The second thing is, if you are getting the palpitations, then the best thing you can do as you're getting them is to go into a hospital and have an ECG, hopefully whilst you're still having the palpitations, because an ECG during the palpitations is extremely helpful. If the ECG is normal when you're getting the palpitations, then you do not have a heart rhythm disturbance. It's as simple as that. Okay, if you're getting the palpitations and someone is doing an ECG at that time and they say the ECG is normal, then you do not have a heart rhythm problem. So a lot of people say to me, oh, I had these palpitations for 3 hours and then I went to A&E the next day. Don't wait. If you're getting the palpitations, they're going on for a while, call an ambulance or go to your local A&E. You're not going to have to wait very long, because you're just going to go and tell the receptionist, I'm having a heart rhythm disturbance or I'm having bad palpitations. Can you please do an ECG as soon as possible? And that sorts your problems out. If you can have that done and it shows that the heart rhythm is normal, you don't need any more tests. That's it. Okay. Now, the second thing to say, there are simple things like blood tests that you should have. The first is having a blood count done, okay? And that's particularly useful because it'll tell you whether the amount of blood in your body is normal or not. Now, if you have a low blood count, so your hemoglobin is low, i.e. you're anemic, then obviously you will get palpitations because your heart has to work much harder to try and get the same amount of blood around, because there's less oxygen carrying capacity within the blood, so the heart has to work harder, and that's why people get a thumping or a fast heartbeat. That is not a heart rhythm disturbance, but it can cause palpitations because the heart is just doing more of what it's supposed to do, and that can sometimes be felt as being abnormal. The second thing to say is, even if your hemoglobin is normal, it is worth asking your GP to check your iron levels, your ferritin, which is a marker of iron stores, your B12 and your folate levels, because these are all components of the blood. And if you're deficient in any of them, you may get a salient deficiency. So your hemoglobin may not be affected so much that it starts falling, but just being short of iron is a much more subtle way and can cause palpitations, can cause the heart to work harder, and therefore it's worth getting those checked out. The other thing to get checked out is always your thyroid function test. Thyroid function tests, particularly as a person gets older, hypothyroidism, hyperthyroidism can creep up on you. And so it's always very important to get your thyroid function tests checked. It's also good to get your electrolytes checked, okay? So you should get your sodium, your potassium, your urea, and your creatinine checked. Why? Because low potassium can sometimes cause palpitations. If your kidney function is bad, then that can cause electrolyte imbalances, and it's worth knowing about that. So those are simple blood tests, and anyone can do those. So there's quick set of blood tests, and that will give you a lot of information. Again, these blood tests do not indicate a heart rhythm disturbance. All they're showing are things that may be wrong within the body, which are making the heart having to work harder. The heart is not doing anything abnormal. It's just doing more of what it's supposed to do. Then there is another easy test, which you should probably have, and that is something called urinary catecholamines, so 24-hour urinary catecholamines. Okay, and basically you can measure the amount of hormones which stimulate the heart in your body, and you can have things which can secrete excess amounts of hormones. Okay, and that particular condition is something called pheochromocytoma. It's rare. Okay, it's not something to be too worried about, but it is worth getting that checked out. So if someone measures your 24-hour urinary catecholamines, and if they are markedly elevated, then that's probably because you have a hormone secreting mass, which is just making the heart work much harder, because the hormone is supposed to make the heart work harder. If you've got lots of hormone being produced, your heart will work much harder. So that's another easy test. Okay, so I think that's worth getting done. Now, the next question is monitoring. Okay, so let's say you've had an ECG, but you weren't getting the palpitations at that time. You can have something called a 24-hour tape. The 24-hour tape is a 24-hour ECG. Okay, the ECG machine is recording continuously for 24 hours. Now, if you're getting lots of palpitations over a 24-hour period in general, then it's useful to have a 24-hour ECG. Remember, the 24-hour ECG is recording everything that goes on in the heart. It doesn't necessarily mean that everything that is being recorded is causing your symptoms. And therefore, a lot of people get very worried because they say, oh, the 24-hour ECG showed 300 ectopics. But actually, does it really matter if you weren't feeling those? If you weren't feeling those, that's just something that's an innocent pickup. It doesn't mean that that's what was causing your symptoms. A 24-hour ECG is useful for two reasons. One, if you're getting lots of palpitations during a 24-hour period, then as long as you fill in a diary card and report when you had those palpitations, the doctor can then correlate that time with the time on the monitor and say, okay, at that time when you were complaining of your palpitations, this was your heart rhythm. Now, if it turns out that when you complain of your palpitations, you are getting ectopics, for example, PVCs or PACs. Then a 24-hour tape is quite useful because it'll tell you how many of them you're getting in a 24-hour period. And we know that as long as they're less than 20,000 in a day, they don't really mean anything. If they're over 20,000, then definitely it's worth getting them suppressed because there is some evidence that the heart can weaken over a period of time. So a 24-hour tape is useful for quantification of how much in the way of ectopy you're getting if the ectopy is the cause of your palpitations. I can't stress this highly enough. There is no need to be getting stressed about ectopics on your 24-hour ECG if those ectopics are not causing you any symptoms. Okay. Then there is another test called an event recorder. Now, with an event recorder, the advantage is you can keep the event recorder on for much longer. So you can keep it on for about 4 weeks or 6 weeks. The event recorder only records when you press a button, i.e., you get your symptom, you press a button, the event recorder records what's going on at that time. So in some ways, an event recorder is very useful because it only records that which is causing you symptoms. Okay. However, the disadvantage of the event recorder is you can't calculate a burden. Okay. But again, does it really matter if you find that, only one of the recordings that you've made is a ectopic and all the others are normal? Then that reassures you that actually you're not only just sensing ectopics, you're just sensing your heartbeat. And incidentally, you've sensed an ectopic. It's quite reassuring. Now, if you say to me that, oh, every time you press the button on the event recorder, we pick up a PVC or a PAC or something like that, then I think it's useful to have a 24-hour tape as well to quantify how many you're getting. So that's about monitoring. Now, if you're getting the palpitations once every 3 months, and they bother you very much, then unfortunately an event recorder is not going to be useful because you can't keep it for more than 4 or 6 weeks. A 24-hour tape is definitely not going to be useful because it's only a 24-hour recording. In that setting, you can have something called a reveal device, which is a small machine, which is the shape of a cigarette lighter, which is implanted underneath the skin, just over here. It takes 5 minutes to implant, and it stays with you for 2 to 3 years, and it will record anything that you ask it to record over that 2 to 3 year period. So that's another thing you can have. But really, I don't think it's absolutely necessary, because if your ectopics are that, if your palpitations are that infrequent, then you probably don't need anything. You don't need to be worried anyway. Then there is, so that's trying to understand the electrics of the heart, okay? Now, sometimes it's quite reassuring to know what the structure of the heart is. In fact, I place a lot of emphasis on knowing what the structure of the heart is, because if you have a strong heart, then regardless of what you have wrong with your heart, the prognosis is generally better than if you have a weak heart, okay? So it's important to get some kind of assessment of what the heart is like, how it functions, to make sure that there's no congenital defects, to make sure that you haven't had a silent heart attack without knowing about it. That's not something which is common. It's more so in older people. But an assessment of the structure of the heart is extremely important. And that is done by means of something called an echocardiogram, okay? And that is an ultrasound. It's like when pregnant women have their babies looked at. Similarly, you can look at the heart and you can see how the heart is pumping. And if the heart is pumping nice and strong and the valves are fine, then you can feel reassured that your heart is structurally normal at rest, because the echo is done at rest. So at rest, it's structurally normal. And that is an incredibly reassuring thing to know, all right? Because it tells you that generally your palpitations are, even if it's a heart rhythm disturbance, it's likely to be benign. Then there are the provocative tests, i.e. tests which are done by stressing the heart. Instead of looking at the heart at rest, it makes sense to stress the heart, i.e. challenge the heart, get the heart working harder. And that is important for several reasons, because if the heart is working harder, then you expect anything that is wrong with the heart to become more apparent when you're stressing it, when you're stretching it to its limitations. So stretching it to its limits, sorry. So in that setting, putting someone on the treadmill is a very powerful test, okay, because you can then firstly see what happens. Does their heart rate go up normally? Do they get more irritability of the heart? Do they get more ectopics of the heart? You can see what happens to their blood pressure, and you can see if there is any evidence that the heart is beginning to starve of blood, because one of the concerns that people always have when they see any kind of heart rhythm disturbance is that, is this heart rhythm disturbance being caused because of starvation of blood, i.e. the blood is not getting to the heart, i.e. are there any heart artery narrowings, angina, which is stopping the blood from getting to the heart, and that's why the heart becomes more irritable on exercise. So that's why an exercise test is useful. Okay, it gives you plenty of good information. A better test than an exercise test is a stress echocardiogram, because in a stress echocardiogram, you can actually not only just look at an ECG and see what happens as the heart stresses, but you can actually look at the heart. So in that setting, what happens is someone scans your heart with an echo, sees if the heart is structurally normal, then they put you on the treadmill. Your heart goes fast, you work as hard as you exercise as hard as possible. At peak, when your heart is beating at its top limit, you scan the heart again. You're also doing an ECG at the same time. And this is extremely powerful information, because you can look at the heart, you can look at the function of the heart, make sure that if the heart is functioning well on exercise, that means it's getting all the blood it needs. So you can be reassured that the heart is not starving of blood. You can look at the valves, and you can be confident that the valves are not becoming more leaky when the heart is stressed. You can look at the ECG and make sure that the heart is not becoming more irritable when the heart is being stressed. And to my mind, an exercise stress echocardiogram is a fantastic, one of the best tests when you're having investigations of your palpitations. So I would always recommend, if I had a patient who came to me, I'd do the baseline, the blood test, the ECG. I would do a monitor of some sort, but I'd also do an exercise stress echocardiogram. Finally, some people end up requiring something called an angiogram. Now, what is an angiogram? If there is a concern that the blood is not getting to the heart, then someone can, you can squirt some dye into the arteries surrounding the heart, delineate them, and take a picture of them through an X-ray, and that'll tell you if you have any heart artery narrowings. And that's what an angiogram is useful. But to my mind, if you were ever asked, if you ever had a choice of what test to do, I would say a simple ECG, the basic blood tests, and a monitor, either a 24-hour tape or better still, an event recorder, and finally a stress echocardiogram. So I hope this was useful information, and I'm really grateful for all the comments, and I'd be, please keep them coming. If you want me to talk about any particular topic in the future, please don't hesitate to write to me on my website. Hang on, let me just find this. So this is my website, yourcardiology.co.uk. Some people have asked me if they can come and see me. You can do so by making an appointment on by ringing my secretary Jeanette on 0190 472 5811. You can also contact me on Twitter, and I also have a Facebook page, Your Cardiology. So thank you very much, and I wish you good night.